When somebody finds out about me for the first time and they reach out, usually the first few questions are around, have you had any injuries? Do you have sore knees? How do you recover day to day? You must be a madman to do this. Things of that nature. Things concerning about recovery and injuries, essentially. Because the majority of philosophy out there, and especially, when I first got into the lifting game, it was like you squat once a week, maybe twice. The second one has to be a really light one. And you give your body many, many days for recovery because leg day is awful and everyone has pains, soreness and all that sort of stuff. And so I kind of understand, where they're coming from. Over the last 800 days, I've had lots of people kind of find out about me. As you guys know, I've been shocked to kind of see this happen. But lots of people have kind of asked me these questions. And over the course of these last 800 plus days, I've kind of gotten a little bit better at replying and concising my thoughts in answering some of these questions. So today was like a perfect example of what I usually like to explain to people. Today I came in with a story that I wanted to play out. The story is the training plan for today. I came in and I wanted to hit 5x5 at around 160 kilos, 170 kilos, depending on how I go. And so that in itself is a hint of what my philosophy is. I want to do 5x5. I want to get 25 reps at something that's quite heavy. But I came in today, and as I usually do, I wanted to kind of start with some pulling exercise. But before that, I've been thinking about what Louis said about the belt squat machine marching. I think that's what it's called. I'm not certain what you call that. You guys just saw it. Basically, you strap on a belt squat machine and you just basically lift one foot off the ground ever so slightly and then the other for about 3 minutes. I did it for 3 minutes. I did 2 sets and my lateral hips were lit, absolutely lit. And it's incredible how much it lit me up. So I wanted to try that as just a fresh off kind of exercise. I've never done that. I did that. And so I knew I wanted to do that, and I knew I wanted to do some pulling and then go into my main meat and potatoes of the day, which was going to be this 5x5 at 160 or maybe even 170, depending on how I feel. But then I started doing the deadlift. I went up to 240, I think, today, conventional, just to say hi to the technique, say hi to the movement. And then the real warm-up was going to be the sumos. And so I worked up with sumos, I want to say to 140, I think I did today. Yesterday I did 160. So I did 140 deadlift. I did 5 sets of 5 with that, really light, really easy. And then I got over to the actual squats, and I was exhausted. And I shouldn't have done the 5 lots of sumos. But as I was doing these sumos, my body was sending me signals that this is what we need to do. And this is basically the basis of the philosophy. You go with the flow. I feel when we are training, we have these rigid ideas of what we need to do and we follow it by the T. And it's almost like we forget about what the body's telling us. I listen to the body, man. And so as I was doing the sumos, my body was feeling incredible. My hip was feeling incredible. My notorious right hip, which hasn't really hurt for a long time, but sometimes it kind of feels stiff and kind of off. And on those days, I feel like my squatting is not going to go well. So I'm doing the first set of 140 of the sumos, and I'm like, wow, that's feeling amazing. I do a second set, do a third set. I'm banging these out. I did 5 sets of 5 at 140. 140 is a decent amount of weight, but it's not, greasing the groove lightweight. And I just kept doing them. And as I was doing this, I thought, I'm really taking this as basically the focus of today and replacing the whole squatting idea. I got to the squats and I worked up to 160, hit that for a set of 5. I never recorded that set. The last set I think I recorded was 140 for squats. And I called it there. I called it there because I was just not feeling it. I was exhausted from all the pulling that I did. And so then I went back. I went back to sumos and I'm like, fine. If the body wants me to do that, it's feeling incredible. The hip is just feeling, I was feeling the hip flexes mostly and it felt amazing. It felt amazing. I'm doing sumos now every single day. And my body's feeling incredible. I've mentioned in the last few videos how ironic it is and how strange it is that a wide stance is going to help my narrow stance feeling. is just strange. Where is the specificity in all of that? So here I am on the allocated, let's say, squat day. I ended up doing a whole bunch of sumos. After that 160 on the squats, I went back to sumos and I did some more 140. I did five more sets of 5 of sumos, and that was the day. So in a nutshell, I did sumos today. That's basically, I ended up doing 10 sets of freaking 5 at 140 as a total. That was not what I wanted to do, but that's where my body took me. And so you call that auto-regulation. I don't know what the term is, but I deviated away from the idea at the start of the training session, and I turned off that track and I went where there was no traffic. Let's call it that. So you're driving your car, you're going from destination A to destination B. You're going on this line. The GPS is telling you this is what you need to do, but your brain, you're an intellectual creature. Your brain is telling you, well, this is all jammed up. There's been an accident on this path. We got to deviate. And you deviate and you go to a different path and you go around that, block up in traffic. And that's what I did. You follow your instinct. You follow the feelings. You follow your feedback. It's almost like I'm developing these ideas that I'm like fully anti-periodization, fully anti-locked rigid programs. I do like periodization in the softest terms of we're going from this place to that place. We're going to go from 60%. We're going to work up to 85%. We're going to go from 10 reps. Then we're going to go down to 3 reps in this course. It's kind of like a crisscross between volume and intensity. I get that. You're kind of building towards a heavy weight, and then you reset, maybe deload or something, and then you go again. And you alter that kind of linear periodization. I get that roughly, but for that micro cycle, for that single day, for that one training session, you need to have the bravery and you need to have the understanding to listen to your body. If I went and squatted, that could have also worked, but my body was like, more sumo please, more sumo please. My hips were just feeling incredible. So that's what I did. And so as people come on and find out about me for the first time, I'd have a few fellas come to the gym today and talk to me, and they were like, when are you going to stop this stuff? And just asking general questions about, what's your program? Like those are kind of the first questions. And I'm kind of getting better in explaining. And so I usually say this, and it kind of emphasizes the right thought in all of this. I usually say to people, I'm not following a program, I'm following a philosophy. And that's really what this is. It's a philosophy. I'm not telling you exactly what to do. I'm giving you the tools to go forward and adapt to the situations you're going to see in front, and just go from there. It's like a protocol. It's like a set of ideas, a set of rules, a set of thoughts that you can employ on your journey through the gym life, through the fitness journey. So if you come in and you're feeling this, you do this. You know what I mean? It's kind of that scouting report that I often talk about in the NBA. I know that guy who likes to take, when he goes left, he likes to take 2 dribbles and he likes to step back, fake once, and step through. That's what the scouting report does. Every time he goes left, he wants to do that. He wants 2 dribbles, step back, pick his dribble up, pump fake, and then go step through. That's what he's going to do. That's what he's going to hit me. So when I come into the gym and my hip feels wrong, I've learned over the last 800 days, do some pulling. And in recent times, sumo pulling is like, wow. He puts the groin on the picture. He puts that hip flexor system in there. The adductors, my hips feel incredible. The squatting mobility feels incredible. Everything feels incredible. So that's not that I had hip pain, but as I was doing these movements, I felt better and better. So it's kind of like a auto-regulated, free training program where you adapt. So one thing's for certain, I'm going to rock up every single day. That's a given. That's what's going to happen. And one thing's for certain, I'm going to warm up. And depending on what I end up having, I react. It's like coaching in the NBA. Okay, we want to go down to the low block with our big man every single time. But what if they start doubling the big man? Well, are we going to force that one big man to go through 2 defenders to score? No. Kick it out, swing, 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 open 3 on the other side. You adapt to the opposition. You adapt to the situation, And biology is weird, man. Like you can't, who knows how I'm going to feel tomorrow? Who knows how I'm going to sleep? Who knows what's going to happen tomorrow? You just don't know. You can have soft ideas what you want to do. Like tomorrow, the focus is going to be, I'm going to try and do sumos again and a little bit heavier and maybe sets of 3. That's what I go. But if I rock up and something's feeling off, I might have to change the course. Be an intelligent creature. That's kind of what I want to get across to people that first come on and try to understand what this is. And obviously, you know, more and more people are coming on and more people are asking the same questions. What I generally tell people, you know, so I speak to them for a little bit, if it's, you know, through Instagram or YouTube comments or something like that on Patreon, I usually, you know, go back and forth, try and explain it. But, you know, I can fit a lot more words in a 20-minute video than on page, or on paper or on screen writing. So then I usually say to people, if you're really interested in this in depth, read Matt Perriman's book, Squat Every Day. If you want something similar along those lines of high frequency training, read Pavel Tsatsoulin's Power to the People. These are the books that I kind of go influenced by. Obviously, there's more to it. And obviously, the way I work and the way I, you know, my trade, nursing, working in ED. So I rock up every single day to work. I don't know what patients I'm going to get. No idea. The phone goes off, the red phone, the emergency phone goes off, the ambulance truck is coming in, the ambulance officers are bringing a patient in, and we sit around and we listen to the patient, listen to the story, presentation. We've got a 55-year-old man that fell from a 3-liter ladder, head strike, on blood thinners. Let's just say that. All of a sudden, I'm like, okay, this is what's happening. I go into the research room. I start preparing what I need to do for this. Okay. I ring the CT scanner. I'm like, are you guys ready? You know, that kind of stuff. So I rock up to work. I don't know what's happening. I don't know what the day is going to be, what sort of patients are going to be. So that's even my work. So it's like I rock up. I know I'm going to rock up every single day to work. You rock up and you adapt and you respond to the situation you're going to be in. So I've got a whole bunch of skills with me. I've got a whole bunch of knowledge with me. I don't know what patient I'm treating. I'll assess them when they rock up and deal with the situation. That's how I treat my training life as well. I rock up, I warm up, and I'm like, okay, so what is the patient today? Is it Ivan, the hip pain stiff? Hip pain? Is it the Ivan, sore hips, tight muscles? Is it Ivan, I got back pain? Is it Ivan, I got a headache? Is it Ivan, I've got poor ankle mobility? Is it Ivan, I'm just tired? Like, you know, just so many different patients, Ivan presentations that come to the gym, and I'm going to find out what's happening and deal with it. That's essentially what my philosophy is. And over time, you see one, neck injury, one head trauma, one head strike. You see 50 of these people that have fallen from 3-meter ladders with a head injury. All of a sudden, you're like, okay, now I have expectations. I've got understanding of how best to treat these individuals that come to the emergency department. You know, and that's like that for cardiovascular people, with heart attacks, with strokes, with kidney injuries, with renal colics, you name it, whatever the presentation is. You know, as you're kind of going through your nursing career, your training career, you have more and more examples, more and more opportunities to learn. And so when something arises, you're like, oh man, I've seen this a million times. I've met this Ivan guy that's tired in the gym a million times. I know exactly how to do it. And that's what this is. It's not just about going in and just putting your head through a wall, doing this 5x5 at 80%. No, man. You don't want to treat that renal colic patient the same as you're treating the CVA patient, the stroke patient. No, that's the wrong treatment, man. You can't be doing a 5x5 on a guy that's just off a night shift tired. It won't work, man. You can do 50 million head scans. The trouble is in the damn kidney. That's what the trouble is. There is a stone in the kidney and it's blocking the whole damn flow. So you can scan the head all you want. You can do 5x5s until the cows come home. That is not going to help this guy. That's how I look at this stuff. This is my whole freaking training philosophy when it comes to this. It's kind of like a reactive, adaptive training session. And some people will be like, that's ineffective. Well, I don't know, man. A lot of people will say that's short-sighted. That could be a criticism. It's a really short-sighted way to go. Well, in my mind, I'm like, okay, so there's a progression. There's a block that I'm working with. I want to work with 5s. But what days this week I'm going to work with 5s? I don't know, man. I don't know. On a good day, I'll do 5x5. Today wasn't a good day. I didn't feel like I wanted to do that, so I didn't. But I still treated the patient that walked through the door, treated the version of Ivan that rocked up today. No matter what happens, man, every single day the emergency department is working. I'm not just waiting for the patient that I want to see. The really good Ivan pumped for 5x5. Oh, I can't wait to do 5x5. That's the patient I want to see. Nah, man, every single day you're going to have people walk through that door with vastly different injuries, complaints, ailments, whatever. You got to treat everybody. Every single day, man, I'm going to rock up to the gym. And there's many different versions of Ivan, but I've got a treatment plan for each one of those suckers. You're going to be rocking up to the gym. I don't care what you do, man. We've got something for you, man. I've got something for you. Even if it's just working out with the damn empty barbell. There's something for everyone. That's the approach that I have. This is kind of like how I think about these things. And so my working life, my training life, it's all kind of the same stuff. It's reactive, it's adaptive, it's always there. No matter what happens, I'm always going to be doing something. It's not going to be just oh no, today we didn't see any cardiovascular patients, so I'm not going to treat anybody. It doesn't work like that. Jonathan Fisner and Balint Bax. Hopefully I said your names correctly, fellas. 2 guys come up on the Patreon list today. Incredible. It's incredible how many people are coming around to support me. I appreciate every single one of you guys. It never gets old to me the feeling is just insane. We're like 2 names away from having 4 full pages of people supporting me. Jesus Christ, man. That to me is just incredible. Incredible. The scale of all of this to me, it's overwhelming, man. It's literally overwhelming to think that there's that many people that care about what I have to say. And I keep saying to you guys, man, I ain't nothing special, man. I ain't nothing special, and no one is anything special. I mean, there are some gifted people in the world who do things easily, it seems. I'm not one of them. A lot of you guys listening to this, you're not one of those guys either. Just ordinary blokes trying to work this stuff out. So to see you guys supporting me, it's absolutely awesome. It makes me want to just pour everything I have into these videos. It's incredible. Thank you for everything, man. Patreon, Instagram, the comments on YouTube. It's just insane, man. Anyway, guys, I'll catch you guys tomorrow. Thank you. Peace out, guys. Later.